housekeeping.
Thank you, Convener. Firstly, to make members aware, unfortunately, we're having some technical issues in the chamber with the cameras, which means we won't be webcasting today's meeting. We have the majority of the committee in the council chamber, but we have some councillors joining us on Teams. In order to allow the people joining on Teams to have the best viewing experience, if the members in the chamber have their devices with them, if they could join on Teams, mute their speakers, mute their microphone and mute their camera, but then if they are speaking during the meeting, enable your camera. You don't have to turn your microphone on Teams, but if you push the button obviously in front of you at the control panel, the sound will then come out of the system that way. Appreciate that's not ideal, but that's the best we can do at the moment, and colleagues in digital technology are working to rectify the situation along with our webcasting provider. I'll do a roll call now just to confirm everyone is here. Convener?
Present.
Vice Convener?
Present.
Councillor Bonsall?
Present.
Councillor Clark?
Present.
Councillor Copeland?
Present.
Councillor Cross?
Present.
Councillor Gregg?
Here.
Councillor MacLeod?
Here.
Councillor Radley?
Present.
Councillor Stewart?
Present.
Councillor Thompson?
Present.
And we have Councillor Graham substituting for Councillor Watson. Councillor Graham, are you there? I can see Councillor Graham is on Teams, but obviously maybe having issues at the moment. But anyway, I'll pass back to you, Convener.
Councillor Radley.
Councillor Graham's just put something in the chat.
Yeah, Councillor Graham has indicated he can't get any sound. Councillor Graham, perhaps if you leave the meeting in Teams and rejoin, that might, of course, you're not going to hear me. That's helpful, isn't it? I will reply to him in Teams.
Thank you very much, Mr. Orchard. Right, we will now begin the business. So urgent business, there is none. Exempt business, there is none. Declarations of interest, anyone? That's fine, thank you. There is no deputations as far as I'm aware. Minutes of the previous meeting, everyone happy to agree? Agreed, perfect, thank you. Committee planner, anyone questions on the committee planner? Councillor Gregg.
Thank you, Convener. I'd like to ask page 14, item 18, the thematic report on mental health and wellbeing. It's been on the committee planner since December last year, and it seems a long time to wait for information back on welfare of officers and staff, and I wondered if there's a reason. I think it's important to have reassurances that welfare is being monitored. So do we have a reason why it's quite a lengthy delay?
Mr. Bell.
Thank you, Convener. Off the top of my mind, I can't recall the precise reason, but I'll circulate that to elected members straight after the meeting.
Thank you very much, Mr. Bell. Any more questions in the chamber or on Teams? Okie dokie. Right, there's no notices of motion. There is no referrals from council committees or subcommittees. We'll go on to Police Scotland for 9.1, and I think we've got Kate Stephen on Teams.
Good morning, Chair. Good morning, committee. So I'm going to present obviously the paper that's. Can you hear me okay?
Yes, we can hear you.
Okay, thank you. So firstly, I welcome the opportunity to update you on the wider road safety activity across the northeast of Scotland. So clearly I recognise that this is an Aberdeen City Committee, but the input today relates to the wider North East, which also includes Aberdeenshire and Moray. So as a starting point and at a kind of strategic level, I dare say committee members will have read the paper. So our local road safety activity generally follows a similar direction of travel to that provided by the recently updated national approach in the publication of Scotland's Road Safety Framework 2030. So you'll see from the paper that a raft of performance indicators exist for national road safety outcomes, and the ultimate measurement continues to be the number of people killed and seriously injured while using the roads. So over the next 3 decades, various casualty reduction targets have been set with the ultimate goal of no one being killed whilst using a road in Scotland by 2050. So clearly very ambitious targets. In the northeast of Scotland, there has always been a strong partnership based approach to local road safety delivery. And in 2017, we entered a new phase with the establishment of the Road Safety North East Scotland. So that the paper has been primarily drafted by Ian Wallace. Unfortunately, he couldn't come along today due to other commitments. I think he's actually on holiday. But we work collectively across the 3 local authority areas and operate through quarterly meetings with both an operational group and a lead officers group as part of that network. So the Road Safety North East Scotland partners include the local authorities, ourselves and Police Scotland, Scottish Fire and Rescue, NHS Grampian, Nestrans and RGU. So there's also involvement from national partners, including Transport Scotland, Road Safety Scotland and BEAR Scotland. Importantly, local authorities and partner organisations will all be working towards the outcomes contained in their own road safety plans or organisational priorities. But by working through the partnership, sharing knowledge and resources, we can add value to the collective approach, and that's the general kind of strategy and idea. So the wider partnership also recognises that on a daily basis, many North East road users will continually and routinely cross local authority boundaries. So the wider partnership approach, I'm sure you'll agree, becomes all the more relevant in that case. So the report contains appendices with Appendix 1, showing the statistical performance in relation to both the numbers of road traffic collisions and casualties between 2011 and 2020 in the north east of Scotland. So in both graphs, the reductions which show falls of 61% and 79% are significant achievements. I'm sure you'll agree. In Appendix 2, it shows the statistical performance for various categories of vulnerable road users, including children, young drivers and pedestrians. And again, the downward trend continue with reductions between 59 and 84%. More recently, and it's not referred to in the report before you, in May 2022, the Key Reported Road Casualty Scotland 2021 was published, and this is produced annually by Transport Scotland and contains the provisional road collision and casualty figures for the previous year. And while recognising this report relates to a period when normal road use pattern were still affected by COVID-related restrictions, the interim provisional 2021 figures, and again, apologies, it's not actually included in the report, but these figures again show significant reductions in the North East road collisions and casualties when compared to 2014 to 2018 in terms of the average. So despite obviously the positive performance, as I set out at the start of my introduction, there are clearly ambitious targets in relation to the 2050 target. So, but a significant frustration remains that most, if not all, of the North East's most serious traffic collisions are deemed to be entirely avoidable. Tragic outcomes can occur from a momentary lapse of concentration through to fundamentally dangerous behaviours, which we continue to see on our roads. These are clearly issues we have to address, and they will continue to be the focus of our work moving forward. The final appendix Appendix 3 details some of the road safety initiatives which are currently in operation across the North East of Scotland, with new approaches and initiatives both local and national regularly being considered. And in fact, we're moving into certainly our Police Scotland's campaign around about drink driving, the summer campaign in relation to drink driving, which commences in the next week or two, and that will run all through the summer months. Finally, I guess I would just say that even with the positive performance reported, I can advise that our local desire is to further improve local road safety performance. Whilst it remains a challenge to accurately assess the impact of a particular road safety initiative in terms of casualty reduction, we will continue to work on issues of relevance in the North East. And that's all I was wanting to kind of introduce in relation to the paper. Happy to take any questions and revert back to colleagues if I can't indeed answer those questions. Thank you.
Thank you very much, and it's great to see all the figures are going in a downward trend. Councillor Gregg.
Thank you, Convener. Congratulations to the division for very good positive results. There are long-term improvements in the reduction of casualties and collisions over the last 10 years or so. So that's very good to see. And obviously there are really good improvements thanks to the very strong and significant commitment to partnership working. We're seeing that through the Road Safety North East Scotland group, and I think that willingness to collaborate is obviously helping to bring those figures down. I thought it was a useful report overall, but I found it rather abstract because, being quite parochial, I would have welcomed information on the city rather than on the whole of the North East, bearing in mind that road safety has been one of the key priorities in the city policing plan for quite some time now. So with that in mind, I wondered if it's possible to have any even outline information on any differences between rural and urban road safety policing. Appendixes, well, certainly the first two appendixes show those very good trends, but is there any standout information on road safety comparing rural to city? Thank you.
Yeah, no, thanks for your question, Councillor. And clearly there are differences in terms of the way in which we kind of police the roads. You know, the rural roads, the network in the rural roads is much more akin to much higher kind of speed related incidents. I don't have details, specific details in relation to the question that you've asked, Councillor, but I'm more than happy to report back to committee in relation to some more specific information around about Aberdeen City, respecting that that element is indeed obviously reported as part of our reporting on kind of 6 monthly and year-end figures in relation to road safety, particular to each local authority area. So that will be coming to committee in September or October, when the next committee or scrutiny meeting is being held. But certainly, Councillor, I'm more than happy to bring something back or send something back in specifically around about those differences.
Thank you very much, Ms. Stephen. Any other questions in the chamber? Councillor Hendrickson.
Thank you, Convener. It's to do with a couple of questions to do with the campaigns to see how we can actually improve. And I was just wondering, you mentioned a drink driving campaign. Is included in that, is there any movement towards a drug driving campaign?
So again, the national campaigns generally in terms of road safety, so we'll have local initiatives that we run in the division, but the kind of national campaigns are very much kind of directed through patterns and trends that we see. So clearly, Councillor, you may be aware that obviously drug driving or those driving under the influence of illegal substances, whether that's drink or drugs, continues to be a challenge for us. So the drink driving campaign don't quote me 100%. I will go back and confirm. I think it is focused on both, and you'll perhaps have noticed certainly over the course of the weekend, just to use a very recent example, there were a number of individuals stopped both in terms of being unfit through failing a swab test at the side of the road, and also a number of drink drivers. So it is something that we focus on collectively, and I'd ask that some press social media activity was generated on the back of the activity of the weekend, again as a kind of further deterrent. But I'll confirm in terms of the drink driving aspect as to whether it includes both. I suspect it does.
Thank you, Ms Stephen. Councillor Thompson.
Thank you, convener. I'd like to start by echoing the words of Councillor Gregg around the congratulations on the reduction in casualties. That's certainly to be welcomed. I did have a couple of questions about pedal cycle safety. Still in this area, getting reports of teenagers in dark clothing with no lights on their bikes. And I noticed that there's the Light for Dark Nights Nestrans funded intervention. Also, anecdotally, I've heard it reported that although the schools do have reflective clothing available for the pupils to use, there's a perception that it's not cool to wear it. And it was just a query around the interventions that you've got. How are they addressing these issues? And also, just to commend the Close Pass campaign on pedal-cycle safety, because I have seen a huge difference in driver behaviour just driving around the city. That seems to have been really successful. And finally, sorry, I'm just rolling a few questions into one. The in-person events that you've held in the past, obviously some of those have been suspended due to COVID, and I was just wondering what the catch-up plan was for those going forward in the future. Thank you.
Thanks, Councillor Thompson. So in relation to it's a real challenge in terms of the coolness aspect that you touch upon, and I know we try and kind of tackle that through the work that's done through partners and through education and through schools. And I guess from my perspective, there's parental responsibility as well to ensure that young people, particularly school-age children, ensure that they are suitably clothed and visible. So I guess, in that perspective, it's through partners and through kind of education and through the media element, notwithstanding the kind of the in-person interaction that we have at these particular initiatives and events, to highlight the safety aspect, but two, the kind of personal responsibility that's on individuals. And I would like to think that certainly in officers in the Northeast, if they were to come across someone similar, if we've got calls with people walking on the roads in dark clothing, if that's reported to us, we would certainly respond to that and provide advice to those individuals in terms of how, the types of clothing that they're wearing and the kind of how they can make themselves and keep themselves safer. So the whole purpose of, I guess, the whole suite of interventions there is to have that message passed in person, have that message passed through kind of media outlets, social media, but also to highlight that kind of personal responsibility in terms of individuals ensuring that they kind of have those. And I would completely agree with your observation around about Close Pass. As a road cyclist myself, it's not perfect, but I have seen a huge difference in terms of the amount of room that cars give to cyclists on the roads, which is clearly a real kind of step change and move forward in relation to how safe the roads are for all road users. And your final question in relation to the kind of, is there a specific person initiative that you were thinking about or you had in mind? Or
it was really just generally because I know that the blue light services have got together in the past to do sort of driver awareness sessions, and it was really just for my information, just generally speaking with these events, if they've sort of started back up again, and is there a sort of catch-up plan, or is it something that's yet to restart?
So I know certainly one that was undertaken in the northeast around about Safe Drive, Stay Alive, which has kind of historically been kind of held at the Beach Ballroom, I think, for a number of years. So that clearly temporarily ceased in 20 and 21 because of COVID, and a working group took the opportunity to review the continuance of that as a local intervention. I suppose just to kind of call out that Road Safety Scotland, as part of Transport Scotland, never supported the approach of that type of staged event. I guess through the kind of lens of almost sensationalising the dangers of what could kind of occur when delivering road safety information. So on that basis, I know there's other kind of aspects that have been introduced in relation to, for example, Police Scotland's new driver early intervention scheme, which has been developed in the kind of west coast of the country, involving young drivers. So these are the types of events that we're looking to kind of bring back, I guess, bring it up to date in terms of trying to address some of the challenges that we continue to see in relation to, again, all road users. And I think, you know, the stage-based event that I'm speaking about, it was obviously involved a number of kind of resources. So there was lots of emergency services, NHS, those affected by involvement in a serious crash, and it was held and focused at, I think, primarily S4. So again, probably not the right age group, you know, in terms of those that are going to be kind of, you know, so I think in that perspective, that particular event is unlikely to continue, unlikely to be kind of picked up, but there are other elements that are coming in behind of that, which certainly all of those involved in the Road Safety North East Scotland or Road Safety Network Scotland are, and I guess research and it would provide that, you know, would be much more focused towards the kind of groups of individuals and much more relevant to the work that we're trying to achieve in terms of those targets set out at the start of the introduction.
Okay, that's great. That's been really helpful. Thank you very much.
Thank you.
Okay, thank you, Ms. Stephen. Any more questions in the chamber? Councillor MacLeod.
Thank you, convener. A couple of my colleagues have made me aware of antisocial behaviour in Union Street, and I think there's a perception from the public that there's a lack of police presence in Union Street. I wonder if you could give us an update on Union Street policing. Thank you.
Yeah,
Councillor MacLeod, it's a little bit off topic of what's been presented with us in the thematic report. So what I'd advise to do is to raise this directly with your local commanders in your area that you cover, and maybe do that by email and keep that offline.
Okay, convener, thank you.
Thank you very much. Any more questions in the chamber to do with this report? That's great. Thank you very much, Ms. Stephen, for coming along to committee today. And I will now move on to 9.2, which is the Scottish Fire and Rescue Annual Scrutiny Report. We have Andy Dick online, I think.
Yes, good morning and thank you, convener. Can everybody hear me okay?
Yes, we can.
That's great, thank you. First of all, I'll start off with apologies from LSO Ewing, who unfortunately cannot be here today. But I'm delighted to have the opportunity to present the Scottish Fire and Rescue Service Aberdeen City Performance Report for the period 1st of April 2021 to the 31st of March 2022. The report is aligned and reports on the progress against the priorities set out in our local fire and rescue plan for Aberdeen City, which was set in 2020 and runs until 2023. Those priorities being improving fire safety in the home, reducing deliberate fires, improving fire safety in the business communities, reducing unwanted fire alarm signals or UFAS signals, and effective risk management and operational preparedness. I may also add that the SFRS activities and performance contribute to the wider priorities of Community Planning Aberdeen, Local Outcome Improvement Plan and its 15 associated stretch outcomes. Hopefully everyone has a copy of our report as presented in the agenda pack, and I'd like to highlight and expand on some of our key performance indicators found on page 37 and 38 that are set to meet the priorities in our plan. First of all, if I could draw your attention to KPI number 1, key performance indicator number 1, which is accidental dwelling fires, and that can be found on page 40. In this reporting year, we had 199 in total, which is 48 below the three-year average of 247. The following ward areas, however, were a little higher than others in the city. That would be George Street and Harbour, Hilton, Woodside and Stockett Hill, Mid-Stockett and Rosemount, Tillage Row and Seaton and Old Aberdeen, Torrey and Ferry Hill. So this is where we will target a greater level of home fire safety activity in the future, and information, visits and inputs throughout the next year. The main cause for accidental dwelling fires throughout Aberdeen City remains cooking related, and this will be given extra attention on all of our engagements and all of our visitations. Second to cooking in Aberdeen City is combustible items that are left too close to a source of heat. And again, we cover this in our home fire safety visits and input and give advice and guidance to all people we engage with. If I can draw your attention to KPI 2, which is on page 41, and this covers accidental dwelling fire fatal casualties. During this reporting year, unfortunately, there was a fatality in the George Street and Harbour ward. This incident took place in sheltered accommodation, and the outcome of a case conference and full fire investigation is yet to be shared. The SFRS carried out reassurance visits in the surrounding area at the time. We made first contact, and we will continue to engage at all levels moving forward with partners to ensure any outcomes are learnt and acted upon. A full case conference will take place on the go-ahead of the Procurator Fiscal. KPI 5, which you'll find on page 44, covers all deliberate secondary fires. It was quite alarming to see that 2 areas in particular were showing large increases in this type of fire. That was Airy Hall, Broomhill and Garthdee, and Nig, Cove and Kincorth. I'll cover the latter just to give an example. There was 63 deliberate secondary fires, which is 30 above the 3-year average for that area, Nig, Cove and Kincorth. Majority of incidents have been in the Gramps area. SFRS continue with annual Gramps walks and talks, where we engage with local schools in partnership with Police Scotland, Scottish Ambulance Service and Aberdeen City Council Rangers. To date, we've engaged with over 700 school children, ranging from primary 6 and 7, firstly delivering a talk at the school with fire safety advice, followed by a walk around Tullis Hill and informing and educating on the dangers of willful fire raising, as well as environmental issues and concerns. We've also recently introduced street sports into the Lauriston area as a diversionary tactic in relation to an increase in antisocial behaviour and willful fire raising. And we're currently engaged with partners and looking at the possibility of a Kincorth Youth Hub. Although this is still a very early stage, working with partners, we're looking at funding streams to identify possible financial income. Our Aberdeen City Local Authority Liaison Officer represents the service in this group and will take forward all actions. I'll move on to KPI 6, which is found on page 45 and covers deliberate primary fires. This reporting year, we've had 83 incidents, which is 13 below the 3-year average. There are no trends identified for these types of fire, the majority being outside, and this ranges from outside structures to garden sheds and automobiles or cars. Our community action team and City Watches deliver engagement sessions to schools and communities on a regular basis, engaging whenever we've had one of these incidents, straight after and throughout the year. KPI 7, which can be found on page 47, covers non-domestic building fires. This year, we experienced 70 incidents, which again is 34 below the 3-year average. Again, there is no trend identified, with the incidents being low, and they're spread across a wide range of property types, from private garden sheds to care homes and to hospitals. The The two wards showing 14, which are George Street and Harbour and Midstockett and Rosemount, were mainly hospitals and student halls, with the causes being cooking or faulty electrical supplies, which were all addressed at the time of attendance. If we move on to KPI 10, which covers unwanted fire alarm signals, can be found on page 49. There's been a steady increase in unwanted fire alarm signals since the lifting of restrictions, with workplaces welcoming back their staff. This was to be expected, and as a result, we've established an ACAM, that's UFAS Forum, which convened in June 2022, and our Fire Safety Enforcement Station Commander will facilitate and chair this meeting. It will involve partners, and it will be attended by a representative Station Commander and Fire Safety Enforcement Officer from each local authority area. Convener, I'm aware I've not gone into detail in all areas of the report and feel that with our staff competency showing on target, our appliance availability remaining strong throughout the reporting year, I've covered the main areas of concerns. I'm of course open to any questions and I'll do my best to address them before I move on to the thematic report on inspections.
Thank you very much. I've got a hand up from Councillor Copeland.
Thank you, Convener. Can I start? I'll put on my camera, hold on. If I can get this to work. Sorry. Yeah. This report, a very good report, and it's quite encouraging figures, but would it be fair to say that you're now getting back to pre-pandemic levels? When we look at some of the things, I was looking at KPI 5, for instance, the last 2 years were sort of much lower, but we're now getting back more to the 2018 figures. Is that a surprise or was that expected?
Thank you very much for your question, Councillor. And yes, I think it's been expected with people coming out of lockdown back on the streets and back out into the big wide world. It was to be expected. We have increased our fire safety enforcement actions. We have increased our community engagement, and we'll continue to do so as the year goes on. Basically, we're going to target any areas that we're seeing increases in. We'll send fire appliances, community engagement teams, and our community action teams to the areas, engaged with community groups and with schools and young people moving forward.
Thanks very much for that. Do you think maybe perhaps that, I mean, I know you spoke about the 3-year average and 3-year average, but this 3 years is obviously going to be skewed with the lockdown. Would it be fairer to say if we took a 4-year average on these, we'd get a better picture of how we're doing?
Absolutely, and I'm more than happy in the next report to report on a 4-year average, and that would give reports from obviously before we went into lockdown and afterwards, and make a good comparison.
Thank you very much.
Thank you.
Thank you. Councillor Gregg.
Thank you. I've got a couple of questions. If I could start off, please, with I'm on page 44. I think that's where the reference was to fire raising in the Gramps, which is classed as an amber. The award-winning Gramps project had a very significant impact in reducing the numbers of willful fire raising incidents on the Gramps. It was very successful. It's good to know that it's continuing, but it's just slightly surprising that we're not getting those good results. And I wondered if there's a reason for that. Is it a tired model that's not working anymore? Does it need to be refreshed, or are there more interventions that are needed?
Again, thank you very much for your question, Councillor. The model is fairly new, actually. It was introduced, it was delivered around all the schools, but as you've mentioned there, it could do with refreshing. So what's happened now is we've got more financial income into it. We've produced a video, a presentation and leaflets coming off the back of that. We're going to, as I said in the last question, that will be targeted at any areas that have increases, and moving forward, it's continually reviewed. We'll look at everything as we go into this new period out of lockdown and out of restrictions, and adapt and improvise as we move along. So yes, it will be reviewed and it will be refreshed moving forward in order to get better results. I hope that answers your question.
Yep. Yeah, thank you for that. I think we're coming up to the 10th anniversary of the Gramps project, so it'll be very good to see it continue. It's done a lot of good work. Could I move on to another question, which is which is about the home fire safety visits. So there is mention of you've carried out 1,552 home fire safety visits, and I was wondering, looking ahead to the winter time, you're slightly below target, so I assume that you'll be doing all you can to build up the number of visits. I mean, I'm thinking of the cost of living crisis with the higher energy costs coming in, and I'm wondering if there's a link, if that should really be an incentive to encourage more home fire safety visits, because I think that people may try to find new ways of keeping warm. I mean, they might, there might be new risks emerging, and I just wondered if you've given that any thought. Thank you.
Thank you again, Councillor. And yes, we have given that thought. As we move into the winter period, our home fire safety visits, which are generally we're targeting high risk areas, but we do cover all risk areas. It's reviewed all the time, as I said before, with the Gramps Walks and Talks, and any new and relevant information gets put into that. Our crews are trained not just to go off the list that we use when we're in someone's house, they're also trained to spot other risks in people's houses. And anything they do spot will be mentioned and advice and guidance given. And if we are not able to give that advice and guidance, we will contact partner agencies that can give that advice and guidance. So we do review it. It will be stepped up. It's mentioned in every engagement session I have with the stations in Aberdeen City, and it's a high priority for us to get that information across, especially in the times we're seeing just now.
Okay. Thank you. Thank you for the joint work that's involved in identifying vulnerable people. I mean, that's making a huge difference. So long may that continue. If I could please ask another question. On page 51, KPI 13 on staff competence. I wondered if you could help to explain what that table tells us. I'm not clear on what that is conveying. KPI 13 on staff competence.
Okay, I'll just get into the page now, sorry. So down the side of the table there, we've got firefighter, crew commander, watch commander and senior manager, and that's in the total column is the total number of firefighters, crew commanders, watch commanders and senior managers. Out of the 110 firefighters, if I refer to the top line, we have 74 competent. That means they have completed their 3 years initial training and they're deemed as competent firefighters. We have 36 in development, and the development phase lasts the 3 years before you become competent. And there's 3 different stages to that: red, amber and green. So when you first join, you're in your red stage, you then move to amber stage, and you then move to the green stage. So we have 4 firefighters close to becoming competent, 11 in the middle stage of the career, and 21 which would be not classed as trainees but working towards competence for the firefighters. Crew commander, watch commander and senior commanders, they don't have to go through a competence level as such, but when they're first promoted, they go on to development stage. So development stage, 13 crew commanders, 5 watch and 2 senior commanders, with 24 crew, 11 watch and 5 senior commanders as marked as competent in role, which means they've done a year's development and a year since that development, which classes them as competent. Does that help?
Yeah, that helps very much. Thank you. I also wondered if the scoring system, red, amber, green, whether that's a fairly routine picture that we would expect, where we would expect to find ourselves with those figures. Is anything? I mean, basically, is there anything to be concerned about with those figures?
There's nothing to be concerned about with those figures as they're showing just now, but I'm sure the committee will be aware that the pension remedy recently came in, and we are getting a high number of leavers in the fire service and having to recruit more to obviously to replace these numbers. And as they come through, we'll start getting a few more trainees. But for this Aberdeen City area and the ACAM area, we're not expecting an overload. We've had very few leavers, and we're looking good for the future.
Okay, thank you. All done. Thanks.
Councillor Radley.
Thank you, convener. It was just, sorry to go back to the grants again. It is my area, and you know it has been a consistent problem for a number of years. It was around whether sort of some of the interventions over COVID were sort of scaled back, and if there's any plans similarly to the last question, there are any plans to sort of catch that up with maybe some of the years that have missed out on some of the intervention.
Thank you for your question, Councillor. And yes, there's definitely plans for the future, for the very near future, in fact. We're aware that during COVID, we didn't get out as much as we'd like to and engage. Our community action teams were working from home. Our firefighters, although out and about for incidents, weren't engaging with the public as much as we'd like to. And we're well aware that we didn't engage in the Gramps area as much as we could have. We have since, and I think since the start of this year, been out a lot more. As I said before, we've engaged with over 700 children since the start of the year, and we're only building on that. We're identifying places throughout the whole city where we can strengthen our engagement, and we can strengthen our, how could I put it? Strengthen our presence in the communities and move forward that way. We've got a lot of ideas, a lot of partnership projects. We're working on I think it's a stretch outcome 10.3 to reduce willful fires throughout the city, and that will be moving about and trying out new ways of engaging and hopefully bringing down them willful fires that are set, especially in the Gramps area, as you've highlighted.
Perfect, thank you. It was as sort of the lighter nights come in, and you know, over the summer, it tends to be the period where these fires and things are slightly more prevalent. We also saw last year the fire at the Loch of Lauriston. So you know, any engagement that you can do with school children, you know, is always welcome. And if there's anything, convener, that we can do to help that, whether that be through sort of the council's social media and things, is that something that we can look at to sort of help on that journey? Thank you.
Yeah, thank you very much. And of course, we're more than happy to engage. We have our own social media, and we're more than happy to share any messages that we put out there.
It's certainly something that can be looked at with the social media team. I know we currently share a lot of water safety stuff through the Aberdeen City Council social media. So obviously we can look at tying in sort of fire safety and stuff as well. So that's not. Councillor Henriksson.
Thank you, convener. Just going back to page 40 and the breakdown of locations around accidental dwelling fires, just wonder if it'd be possible to get some sort of comment on the high incidence of these in particular my ward, George Street Harbour, but also in Hilton, Woodside and Stockett Hill and Tilly Drone, Seaton and Old Aberdeen. I just wonder if there's a population density factor coming into this, or whether it's building type. A lot of them are tenements and flats, or whether there's any other underlying issues that we could perhaps look at to resolving some of these issues.
Yeah, I understand what you're saying there, and it is a large population density. The largest type of primary fire is accidental fires in the home. It's also the primary cause of most fire casualties and fatalities, unfortunately. Their prevention, therefore, is a key focus of the service's community safety activity, and we do concentrate in the more populated areas, which we class as more high risk. The reduction of fire casualties is clearly linked to this priority, and the reduction of fatalities and casualties is the core of our preventive and early intervention activities carried out. Significant contributing factors associated with a number of fire casualties include lifestyle, independent living strategies, smoking, consumption of alcohol, and prescribed and non-prescribed drugs, individual capacity and vulnerability, and an aging demographic. We're aware of this. We do work hard in the areas, and the area you mentioned there, your area, is high on our list of priorities, and we do send CAT teams, watches, and engagement teams out to that on a regular basis. After any incident, there's always pre-incident fire safety advice given.
Councillor Cormie.
Thank you very much for this report. And if you bear with me, because this is the first time that I've been on this committee, and I'd like to refer to page 49, the unwanted fire alarm signals, and in particular Midstock Rosemount. I appreciate the hospital comes under that area, but down in Rosemount there's the halls of residence, RGU, and usually on a Sunday that sometimes there's 6 units called out to these unwanted signals, and obviously it's quite a dense population of housing around about that halls there in Farmers Hall, and you know, the folk get quite concerned. Who is actually paying for these fire units that are called out unnecessarily? Are the folk that own the halls being billed? Obviously, this must be eat into your resources, and people ask me, who's paying for all these appliances coming out, and indeed the fire servicemen themselves going out and through these halls? Thank you.
Councillor, thank you for your question. It's very pertinent. Yes, we have a system in place for unwanted fire alarm signals. So when we turn out, I know there is an abundance of appliances getting turned out, and that's due to the risk with the high amount of sleeping accommodation in the halls of residence. So the appropriate response is turned out. Now, it isn't always necessarily needed. If it was a fire, then we would have the correct resources there at the time. But there is a system. So after one false alarm, obviously we give advice and guidance, and we work with the halls of residence to reduce the unwanted fire alarm calls. Sometimes from personnel using showers with the door open and steam setting off fire alarm systems, from cooking, from deodorant spray in bedrooms and such like. So we work hard with the universities and the halls of residence to reduce these by educating and by community engagement with the students. However, if it's continuous and we have like a target, not a target, I'll call it a target. So after 5, 6, 7 fire alarm calls for the same purpose, we would then issue a letter warning that if they continue and there isn't a reduction in them, we may charge or start charging the premise until such times as the fire alarms are reduced back to normal levels. This doesn't often happen. Usually our engagement with the premise works, but every year there's a new batch of students, a new batch of people studying, and every year it does its peaks and troughs. And I'm aware that it is expensive to turn out these fire appliances, but they are turned out for a very good reason. And we do have a system in place to address that should it reach unwelcome levels. Does that answer the question?
Thank you very much. If there's no other questions on this report, we'll move on to 9.3, which is the inspections thematic report.
Thank you. Try and get my mouse back. Okay, so this is the thematic report on SFRS inspections, and it can be found on 59 of your agenda, on page 59 of your agenda. The recommendation for this report is for the committee to consider the information contained within in relation to prevention and protection. On page 59 and in sections 2 and 3, we cover fire safety enforcement, and this refers to our programme of legislative fire safety audits within relevant premise as defined in Part 3 of the Fire Scotland Act 2005. Scottish Fire and Rescue Service has developed a fire safety policy framework that prioritises fire safety enforcement audits in premise where the greatest risk from harm from fire is present. For example, care homes, hospitals, and homes of multiple occupation. You'll note in the tables displayed on page 60 that throughout the reporting year, our fire safety enforcement inspections peaked above and dipped below the red linear line, with lows as low as 5 in April 2021 to 53 in January 2022. These peaks and troughs relate to the restrictions that were in place at the time of year and the understandable reluctance due to COVID-19 and the fear of spread of some establishments, such as care homes, to admit our staff on premise. However, in table 3.3, it's pleasing to see that the obvious improvement with the lifting of some of the restrictions in comparison to the year before in 2020 and 2021. And with this lifting of most restrictions now, we are on the upward trend, and hopefully we will report in our next quarterly report a much improved picture throughout the whole range of inspection and audit. Next, I'll draw your attention to section 4 on page 61, which covers new legislation. And this legislation covers short-term lets and impacts thousands of existing, new and relevant premises that are providing sleeping accommodation across Scotland. Whilst a number of these premises may already be identified within the SFRS policy framework and be part of our current auditing process, the likelihood is the majority will not currently be subject to any type of audit. The SFRS is engaging with external partners to identify the additional challenges in terms of number of licensing applications for short-term let type relevant premises. And local authorities will have until the 1st of October 2022 to establish a licensing scheme for implementation, and existing short-term let hosts will have until the 1st of April 2023 to apply for an operating license. The final deadline for all STL hosts and operators to have an operating license is the 1st of July 2024. The license will apply to the following: home sharing, home letting, home sharing and home letting, and finally, a license for secondary letting. It's currently difficult to estimate the number of new license applications that may come from this new legislation. One local authority has already indicated they have identified over 1,400 new premises. However, further discussion shall be required across Scotland to provide more accurate figures, and in particular for Aberdeen City. A Scottish Fire and Rescue Service working group has been established to oversee this, which will support the delivery of a process for managing STL within appropriate timescales. The possible impact on the SFRS may be significant, as you can imagine, and the standardised national approach will be required for the appropriate management of any additional workload, including additional staff if required. A number of options have been considered for implementation, and further consultation with local authorities throughout Scotland, in our case Aberdeen City, may be appropriate through the working group to review all current working practices and for licensing activities. Page 62 and section 5 covers 4 areas of inspection currently carried out in line with firefighter safety. These consisted of 390 operational intelligence visits, 215 high-rise domestic building visits, 30 care home visits, and 429 hydrant inspections. These were carried out throughout the reporting year, and the information gathering carried out in these inspections provides our operational crews with familiarisation, knowledge of layout, and any risks on the premises throughout Aberdeen City. That concludes our inspection report, and I'm happy to take any questions.
Thank you very much. Any questions in the chamber or online? Councillor Gregg.
Thanks. I'd like to ask, thank you for the report. I'd like to ask about the resource that's available to deal with what are new and emerging demands. It's good to see that there's a team of, I think, 10 fire safety officers for the North East. That's good, but it would appear that the workload does appear to be increasing with the new licensing system. So there's quite a bit of new bureaucracy coming in there that will have to be managed. That will be quite complex, I imagine. There's mention of the domestic buildings inspections of care homes, and also hydrant inspection. So there's quite an amount of important preventative work there. So I'm just looking for comfort that there is sufficient capacity there to ensure that all of this crucial inspection work can be done.
Councillor, again, thank you for your question. Yes, so in relation to the short-term lets, that will be carried out by, well, our existing team of 10 fire safety enforcement officers at this time, although the working group, which is in its very early stages, is working on that. And any capacity issues will be identified through that working group and be addressed at source. I'm not privy to how they're going to go about that, or what the case may be for bringing in staff to enhance that delivery, but that's covered by the fire safety enforcement side at this time. You mentioned the domestic buildings, the hydrant inspections and such like. This is all carried out by our operational staff. So our watch-based whole-time staff in Aberdeen City, our 3 whole-time stations, and our retained staff in outlying areas such as Dice, Aberdeenshire and Murray. So that is covered by operational staff, and the short-term lets won't actually, well, unless that's talked about in the working group, won't actually affect them. It would be the fire safety enforcement staff that would affect, and they will be looking at ways of coping with that demand and taking it forward through partnership work with councils and local authorities, through other agencies.
Okay, thank you. I just think it's particularly encouraging that there's been an increase in the number of fire safety officers, so that's very welcome and very reassuring. Thank you.
Thank you, no problem.
Councillor Thompson.
Thank you, convener. Firstly, just a comment around the short-term lets. That sounds like it's going to be a huge piece of work, especially the amount of churn there must be in some of these short-term let premises. So yes, it's good to see that you've got a robust plan in place to address that. I was just wanting to ask about care homes. I mean, as the report states, there was a drop-off in the inspections due to COVID, quite understandably. And I just wondered what measures are now in place to catch up with that and to rectify the number of inspections that are taking place. Thank you.
Yep, no problem. So, yes, I think it was 30 premises were inspected over that reporting year, and I think we have up to 83 care homes in the area. That has been prioritised now. Any care home that did not receive a visit in that reporting year is receiving one in the first quarter of this year. We have our fire safety enforcement officers prioritising that, and moving forward, we hope to get anyone that wasn't visited last year visited this year, as a matter of course.
That's great. Thanks very much for that.
Thank you.
Thank you very much. And if we don't have any further questions, Councillor Bonsall.
Thank you. There's mention on page 60 of a remote audit procedure, and I wonder if you could describe what that involves.
So yes, the remote audit procedure was brought in during the first lockdown, and that was using modern technology as we're on now with Teams and such like, where we would contact a care home. A fire safety enforcement officer would contact a care home. He would ask for all the documentation that's usually inspected on a visit to be electronically emailed to them. They would inspect the documentation. Once they'd done that, they would go back to the care home with any questions they had. They would then do a video tour on an iPad or an iPhone or Samsung or whatever the technology was. They would do a video tour and inspect any areas that they had of concern. It's important to note that our fire safety officers inspect these premises once, maybe sometimes twice a year. They're very familiar with the premise, and they're very familiar with the staff that are on the premise. So these tours did not drop the safety standards, and the video tours around the premise were always done in great detail and with questioning afterwards. Does that highlight anything, or does that explain?
Yes, thank you, that does.
Thank you.
Thank you very much. We'll now move on to the draft strategic plan.
Yes, finally, Convener, we ask that the committee consider and provide feedback for our SFRS strategic plan for 22 to 2025 and hope they've taken the opportunity to have their say. The overarching plan clearly states our priorities and will determine what we will do and where we will use our resources between 22 and 25. Our plan aims to show how our actions contribute to the priorities set within the Fire and Rescue Framework for Scotland. And this framework, which is developed by Scottish Government, and contributes to our strategic plan, which has been designed to show how we aim to deliver against it. Just a quick example of that is strategic priority 1 would be prevention and protection. And I've covered that in our thematic report today in the case of inspections. And strategic priority number 5, effective governance and performance, which was delivered in today's 2021-2022 performance report. Everything we do will link into the Fire and Rescue Scottish Framework through our strategic plan. And I thank you for the opportunity to present this today, and I hope the information provided has been both useful and informative throughout.
Thank you very much. Any questions? Councillor Gregg.
Thank you. This is clearly a national plan,
Yes.
but it really fits into what we're doing locally. And I think that balance, particularly the balance between prevention and innovation, really highlights the way of working that the fire service in Aberdeen has been following for many years. So for that reason, I mean, it would be useful to get feedback on, or to get guidance on how we can keep a track of that innovative thinking that the fire service continues to be involved in. We heard, for example, just a few moments ago about the Gramps project, on which the local-based fire teams helped to create through their commitment to partnership working. And there are many other examples. There are strong regional and national resources and facilities in our area. I think the rope management system is something which is a real strength for our area. So we've got a lot to be proud of in Aberdeen through our fire and rescue service. So looking ahead, it's a plan of action. So I think it would be particularly helpful if the committee was to be provided with some kind of advice and guidance on how we can track and monitor the good work that's going on. That's all.
Thank you, Councillor. And yes, I'll ensure that's included in reports in the future. We do a quarterly update, and we can update on the progress against the new strategic plan and how we're planning on and weaving that into our local fire and rescue plan for Aberdeen City.
Thank you very much. Any further questions? Okay, is the committee happy to content reports 9.1, 9.2, 9.3 and 9.4? Thank you very much, and thanks very much for Ms. Stephen and Mr. Dick online. Okay, we'll now be moving on to 10.1, which is the Adult Support and Protection Inspection Report. We have Campbell Thompson and Val Vertigans in the chamber.
Good morning, Convener. My name is Campbell Thompson. I'm the independent chair of the Adult and Child Protection Committees in Aberdeen City. I present this report on behalf of Claire Duncan, who leads on adult support and protection for Aberdeen City Council. The report's there to be read, but if I may just touch on a few areas and highlight them to you. The Care Inspectorate, as you'll be aware, carry out inspections throughout Scotland in relation to adult and child protection, and on behalf of Scottish ministers. And their process has been, obviously, like everything else, impacted on by COVID. But in essence, the methodology is to conduct a staff survey, which was very well engaged by Aberdeen City's partnership. thereafter to do file reading or to audit files or records of adults at risk of harm, and also to have focused meetings with key individuals and practitioners throughout the city. Thereafter, they draw outcomes from that, and if I may just touch on two of them, they're contained within, I think, through page 91 to 92, but two of the key ones are: our key processes are effective with areas for improvement which are outweighed by clear strengths, supporting positive experiences and outcomes for individuals, and our strategic leadership is very effective, demonstrating major strengths in supporting positive experiences and outcomes for individuals. And I can say that this is one of the best reports that there has been nationally. And I think that we should be minded too that the reporting period was during a global pandemic when there was an unprecedented demand for service. I think what it illustrates is the strength of partnership that I've already heard sitting in this meeting that exists within the city. And I think it would be fair to say that during such challenging times, it would be worthy of commending the staff, both within the statutory sector and indeed the voluntary sector, who work so tirelessly to serve the needs of those adults at risk of harm. But most importantly, this is about positive outcomes for adults at risk of harm, which is absolutely key. That's what we all strive to deliver. And it's important that even having such a positive report, that we continue to build on that we continue to improve in that work. And as a result of that, the report informs us of some areas that will be included within the one improvement plan. I can say that there were no areas. There was a self-evaluation done initially. So these areas are already identified. That there's more work that requires to be done. So the next steps are that improvement plan is further developed, and we work with the Care Inspectorate to ensure that we continue to strive forward as a partnership to deliver the very best service. The report's there to be read. I'm joined today, as you've alluded, by Val Bertigans, who's very much heavily involved in adult support and protection, and happy to take any questions.
Thank you very much. Any questions in the chamber or online, Councillor Gregg?
Thank you, convener. It's very good to see Mr. Thompson again. The report is extremely positive, and many thanks to everyone involved for the really encouraging good work that's been going on in adult protection. Within that context of very strong, productive, focused work, there is mention of a couple of areas of improvement. There's one is advocacy, the other is about the processes, which has been mentioned. Although when we mention processes, the report does qualify that by highlighting that actually audit and an assessment work is actually very good. So it's so context is everything. But there is mention of an improvement plan for the future. And I imagine that will look in particular at those 2 points. Advocacy is very important. I mean, I would like to see more emphasis on that. Will the improvement plan, will that be an action plan for us maybe to have a look at in the future and just monitor? Is that?
Yeah, thank you for the question, Councillor. Yes, you're absolutely correct. Advocacy was very much highlighted in relation to an area of ongoing improvement. I'm very thankful to say that within the city there's a stakeholder committee that's led by Maggie Hepburn from ACVO, so there's that involvement already from the voluntary sector. But that is one of the areas that already is set within our improvement plan. But we will take the information that the Care Inspectorate have gathered. We'll update that improvement plan so that we can be more focused in relation to what we're doing, and in relation to bringing back an update as to progress. Then, obviously, with the convener's permission, I'll take that back to Claire and the team, and maybe at an appropriate time, you know, whether that's maybe 6 months or even beyond, then I'm sure that could be done.
Thank you.
Yep, I'm happy with that, and obviously echo Councillor Gray's comments about the amount of work that's been in behind here throughout the pandemic. Any other questions? Councillor Copeland.
Sorry, convener. It's more a comment as opposed to a question. I think it's quite heartening to recognise in this report that there were some things that could be done better, especially along the decision-making processes. And can we maybe get a wee bit more detail as to what's been done to try and improve that? Because I noticed it on page 91 under priority areas for improvement. But I think it's good that we recognise something could be better, but it'd be nice to know what we're doing about it.
You're absolutely right, Councillor, and I hope that my balance has given a view to you that there's always room to improve and always room to learn. I think the city, in relation to its internal audit process and obviously this external audit, always welcomes that and embraces it, and we always strive to move forward collectively to enhance that. But in relation to those 5 key points that are raised, one of which is the same that Councillor Gregg had raised in relation to advocacy, those points are the very key elements of the improvement plan. And that's the reporting that we'll be doing. And again, with your permission, convener, I think it would be, more than content, but again, perhaps one for the City Council itself, but I can't see any issue whatsoever with us coming back in relation to our performance against those in a 6 months' time, but absolutely picking up those points. It's absolutely critical, or why have an inspection?
Yep, absolutely. Any other questions in the chamber or online? Nope. Are the committee happy to note the contents of this report? Okay, thanks so much for coming. Okay, we'll move now on to 11.1, which is the UCAS annual audit. And Laura Cruikshank, are you online?
Thank you, convener. So this report is to update the committee on the results of our most recent surveillance audit visit from UCAS in relation to the Aberdeen Scientific Services Laboratories ISO 17025 accreditation, and I ask that the committee endorses the continuation of accreditation as a licence to operate. ASSL provides scientific analysis for Aberdeen City, Aberdeenshire and Moray councils, as well as a variety of private clients. And our UCAS accreditation is central to this because it serves to demonstrate the quality of our analysis via external independent assessment. Our continued accreditation also encompasses our analysis of drinking water testing specifications, which are required for the testing of potable water supplies. And ASSL is currently the only laboratory to offer this service in the north of Scotland. Testing of drinking water forms part of a service level agreement, which we hold with within the council and within our local authority partners. It accounts for 85% of our 1.2 million turnover and generates a significant income from private clients. This allows the laboratory to operate on a cost neutral basis while still providing statutory functions under food and agricultural legislation. Continued accreditation is therefore of great importance for the laboratory, and I'm pleased to report that following a remote assessment in March 2022, the recommendation was that the laboratory retained its accreditation. And if you will allow me to expand briefly on our current operations convener, between April and May this year, ASSL relocated to a newly refurbished facility within the James Hutton Institute building. It is hoped that this will allow greater opportunities for collaboration on a wide range of income-generating projects, as well as raising the profile of the laboratory and providing an increased measure of resilience. As UCAS require evidence of continued adherence to the quality standard following any major change within any testing facility, we have voluntarily suspended our accreditation pending submission of evidence demonstrating the same high standard of analytical performance in our new location. The accreditation process has already commenced, with reinstatement estimated to be completed in July for our drinking water methods, August for our remaining microbiological and environmental chemistry methods, and October for our food chemistry section. To ensure provision of services, we will continue to perform analysis on a non-accredited basis for all local authority and private clients until this process is completed. Thank you for your attention, and I'm happy to take any questions.
Thank you very much. Any questions in the chamber or online? No, there's no questions at this time, so the recommendations are to note the work being undertaken and to endorse the continuation of accreditation as a licence to operate. Are the committee happy to note that? Thank you very much, and thanks very much for coming on to have this report. We'll now move on to 12.1, which is the Building Standards Activity Report, and we have Gordon Spence, I understand.
Yes, thank you, convener. As a reminder for members, this report is the Building Standards 6 monthly assurance reporting, just confirming our role in securing public safety in relation to buildings that might be found to be dangerous, and also using our enforcement powers in relation to unauthorised building work or unauthorised occupation of buildings without a completion certificate. So activity over the reporting period has been surprisingly low. That's generally a good thing. It means there have been less issues with buildings presenting a danger or unauthorised work, and that is despite 2 very windy periods back in January and February, where things tend to fall off buildings or they become dangerous. But we actually only had a handful of call-outs to attend as a result of that, so that was good. So if I can draw your attention to the table in Appendix 1, the reporting period started with 11 notices outstanding, which has increased to 13 notices over the period. There's been a number of informal visits where any issues were either resolved without the need for statutory notice, or indeed were deemed actually not to be dangerous. I've previously confirmed to this committee that it's quite common to have notices outstanding at any point in time, and that's whilst either the appeal period of the notice is in operation or where arrangements are actually being made to remove the danger. And sometimes those arrangements can take quite a time to arrange contractors to remove a danger. But I just wish to reiterate that the remaining notices are monitored and there is nothing presenting a danger to the public. We're just liaising with the owners to achieve a successful outcome. Happy to take any questions.
Thank you very much for that. Any questions in the chamber or at home? I have Councillor Thompson.
Thank you, convener. I'd just like to ask, I know that sometimes establishing ownership of buildings can be an issue. Is that something that has an impact on your work, especially thinking around some of the commercial premises where it could be shell companies, pension companies that actually own the premises? Is that something that causes you an issue?
Yes, thanks for that. Very much so. So yes, sometimes establishing the owner and, more importantly, actually making contact with the owner can be very difficult and troublesome. Once we get the owner's details, we'll certainly serve the notice, and that then allows us the power, if the notice is not fulfilled, to actually intervene and carry out work. So the system does work from that point of view. The other issue is in multi-ownership buildings can be very difficult and very time-consuming, liaising with a tenement building that's maybe got a loose chimney, liaising with all these owners and trying to get them on board to carry out repairs themselves can be very difficult. And again, sometimes we have to intervene and then recoup costs from the owners. Thank you.
That's great. I suspected that might be the case, speaking as previously a long-term resident of a tenement. But thank you very much for your answer. That's very useful.
Thank you very much. Councillor Copeland.
Yeah, thank you, convener. I apologise in advance for this. I should have probably sent you an email. When you've served the notice and the work's been done, obviously you go back and you do an inspection to make sure that it's right. Do we ever do repeat inspections to see that there's been no further problems? Because obviously buildings are decaying, people are doing the minimum they have to. Do we ever go back and check that buildings are still safe?
Yes, thank you for that. So there are situations where something might be flagged up to ourselves as potentially a danger. And actually, when we visit, it's maybe not an immediate danger, but work is required, otherwise it'll progress to a danger. So in these situations, we do liaise with the owners and try and encourage them to make repairs so that something doesn't become a danger, and we will monitor those until we get a successful resolution. What if we've actually served a dangerous building notice and the work is carried out and complete, then the notice is then closed and it's registered in the building standards register as closed. We're very unlikely to then carry out further inspections because effectively, the danger is removed and our role is complete in those circumstances.
Thank you for that. Again, I apologise. I should have sent you an email about that. Thank you.
Thank you very much. Any further questions? Councillor Cormie.
Yeah, thank you, Kevin. Thank you for this report regarding dangerous buildings. Are you using it for rooftops and chimney stacks and things like that? A lot of my ward is made up of tenements over 100 years old. Is drones being used to look at the rooftops at all, the building standards? Thank you.
No, the quick answer is no. At the moment, we have investigated being able to use drones. There's some difficulty with legislation, I think civil aviation legislation, around being able to use drones in urban areas. So the quick answer is no, we have not used drones to assess these. We have to use old-fashioned methods of maybe binoculars or a cherry picker if it's necessary to get in a bit closer to inspect a roof.
Mr. Bell.
Yeah, just to add, it was just last week, Councillor Cormie, that the Director of Customer was in touch with me with a view to the organisation pursuing the use of drones in situations like this. So I can give assurance to the committee it's something that we're actively looking into at the moment.
Thank you very much, and that sounds very innovative. Any further questions in the chamber or at home? I'm seeing no. Is the committee happy to note the contents of the report at 2.1 and 2.2? Agreed. Okay, thank you very much. That concludes today's business. And thank you very much for coming along.